You are listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I am your host, Celine Yeager. Each week, I bring you advice from athletes, scientists, researchers, and other experts to help you feel and perform your best, no matter what your hormones are doing. This show is a production of Live Feisty Media. Hello, strong, feisty women. I hope you all are well. So, I was reading about Venus Williams recently, who, at the age of 45, became the second oldest woman to win a tour-level singles match in professional tennis at the DC Open, which I just love to see. But then as I was flipping around through Venus Williams stories, I saw a couple others that I didn't love to see quite so much, and I will drop them in the show notes because they're really worth checking out. In these stories, she talks about how she suffered with nearly debilitating uterine fibroids for nearly 30 years before finally getting relief last year. And she was talking about how she was vomiting from period pains during the French Open when she was 16, though I'll note she still won. And how she didn't even get diagnosed properly with these fibroids until 2016. And at that point, her doctors were like, yeah, fibroids suck. We'll keep an eye on them. It wasn't until 2024, again, last year, that Venus finally got real care. She told Self magazine that she found a fibroid care clinic while scrolling through Instagram. And that made her realize, like, hey, maybe there is designated care for this out there. And that led her to the Center for Fibroid Care at NYU Langone Health. And that led her to this week's guest, Dr. Taraneh Shirazian, who is the founder and director of that clinic. And as I was reading, I learned that up to 80% of women will be affected by fibroids by age 50. And I was like, hold the phone. And then, as often happens, women in the Hit Play Not Pause Facebook group are like, hey, Celine, how about a show on fibroids? They're pretty common and they're awful. And yeah, I completely missed the boat on this one for the past 5 years. Fibroids were just not on my radar. But boy, they are now. And I'll tell you, I cold called Dr. Shirazian after reading that article, and she responded instantly because she wants to raise awareness too. And she's just good people, as they say. Along with her work at the Fibroid Care Center, she is also founder and president of Saving Mothers, which is a nonprofit dedicated to reducing preventable maternal deaths worldwide. You can find her on Instagram at Dr. Shirazian. I'll link that in the show notes along with those stories. I hope you enjoy this one as much as I did. All right, before we get to it, I have a couple of cool announcements. I am going to be at a couple upcoming feisty camps and retreats that are super rad. And I will tell you that these live events where we get together in community are really just one of my favorite things that I do here at Feisty. It's always such a special time. So the first one is the Feisty 40 Plus Strong Retreat. It's a 2.5-day immersive weekend with women 40 plus for hands-on coaching, expert insights, learning how to lift heavy, program, get strong with women just like yourself. It's being led by Feisty favorite Cassie Neiman, who has been on the show and done a bunch of Feisty retreats. She will be leading that camp. It is November 14th through the 16th in Albuquerque, New Mexico. I will drop a link in the show notes so you can sign up for that. And then the second is a bike mechanic school and gravel camp, and that is in Tucson, Arizona, February 12th through the 15th. And that is a 4-day women's only gravel camp, and it's part bike mechanic school and part riding adventure. We get to learn hands-on skills like setting up tubeless tires and packing your bike, and also ride epic mixed surface routes and connect with 24 like-minded women just like yourself with mechanics from Live Cycling, Casey and Paige helping out, as well as Coach Serena Bishop Gordon giving us tips and skill clinics. And it's going to be a rad time. So I will drop a link in the show notes for that one as well. While you are in those show notes, sign up for my free weekly Feisty 40 Plus newsletter with all the training, nutrition, hormone, everything news you can use. There's lots of you, 50,000 plus, who have signed up, and I really, really appreciate it. And speaking of appreciate, thank you for the great reviews and 5-star ratings that continue to come in as we reach, unbelievably, our 5-year anniversary of this show. I am grateful to each and every one of you. Speaking of grateful, thanks MIDI Health for your support of the show. I continue to hear great things from community members who are finally getting the care they need through MIDI, so I really appreciate their support. All right, enough of me. Let's have a few words about our awesome sponsors and get on with the show. All right, Tara, as we were talking about before I hit record, I am so very, very grateful that you answered my cold call. I don't cold call a lot of people that I don't know, but this was a topic that, as I have mentioned to you, just sort of slipped out of my radar, and I'm still kicking myself that it slipped off my radar for this long, but we're here and I appreciate it. So thank you for coming on to talk about fibroids today because a lot of people are suffering with them.
Yes, definitely. Well, first off, thank you for inviting me. I always appreciate a cold call. I'm of the generation where, we would just pick up the phone and call.
Yeah.
So, so I think it's great that we're doing this. I'm so happy it's getting attention. I'm happy fibroids are getting attention. I'm also happy that menopause is getting attention. So this is, I think, just a perfect time to discuss both. Yeah.
Do you think that Venus Williams had a lot to do with it? And I only ask that because, well, that's part of the reason that I found you is because she's been so outspoken. And I love when women like her do that because it is so important.
Yes. So, I mean, it's really my honor to have had her, walk into my office. But I will tell you, the first thing she said to me when she walked in was, I want to help you educate women on this topic. Like, I
Wow.
want to help more women know about fibroids, more women be educated, and to help raise awareness. So, and that's something that I myself have been trying to do for some time. But, obviously, when you have a world class celebrity, talking about it and telling her story, I mean, that elevates the conversation in a way that, I think one regular person can't do by herself. So
Yeah,
I'm
100%.
beyond happy. I am just ecstatic that she's raising awareness, and I will always support in every way possible. So I'm excited. Yeah.
Excellent. Well, let's start with the basics because there's so much, as I mentioned, that I don't even know. So, what exactly are uterine fibroids?
Right. So uterine fibroids are benign, largely benign tumors of the smooth muscle of the uterus. So it basically means that the uterus develops these tumors that are typically not cancer. And I think that has been one reason that it sort of has not gained as much, recognition or as much awareness as other things. They're largely not cancer, but because they are so prevalent, 80% of all people with uteri have fibroids.
That's crazy to me.
80%. I mean, it's like an epidemic if you look at
That's
just the
huge.
numbers. Yeah, yeah, exactly. It's tremendous. And on a global scale, that's millions upon millions of women or people with uteri around the globe. And so it really affects the majority of all women globally. And it also can create a number of different types of symptoms. So you can have anywhere from heavy bleeding and pelvic pain, pelvic pressure, to infertility, sexual dysfunction, urinary frequency, urinary symptoms. So the range is huge in terms of symptoms, depending on how many fibroids you have and where they're located. So it's an epidemic. And then to make it even more complicated, it's also recurrent. So that means that even if you take them out, they will likely come back. And so all of that puts it in kind of the chronic and recurrent category in terms of health issues.
So, a couple of clarification questions on that.
Yeah,
They are generally benign in that they don't, we wouldn't classify them as quote unquote precancerous, then, correct?
correct. Correct. Cancer sarcoma, which is a special kind of cancer that forms in a fibroid, is not very common. It's
Okay,
0.3%. So not
gotcha.
common at all. So most fibroids, because there's so many people that have fibroids, the vast majority of fibroids are benign.
Do we know with that large of a percent, it seems to me, correct me if I'm wrong, that a fair percentage of them must be asymptomatic, or is that not true?
Yeah, no, that's fair. So about 40 to 50% are asymptomatic. Although I do think that a lot of women are not aware of the symptoms. So, like, how we define something that's asymptomatic or how we collect that data, which is a big thing in all of women's healthcare, is really, something that probably needs to be looked at. But asymptomatic means women aren't necessarily complaining of symptoms, but things like bloating, weight gain, changing your pant size, wearing bigger clothes, those all could potentially constitute big fibroids growing, but would be classified as asymptomatic, for example.
Huh. So is this I have so many questions. So as so
I know that was a lot.
well, it's just like now I'm just going through history. I'm going through my youth.
Yeah.
I'm going through everything I learned.
Well,
So
that's what I
I,
do regularly. I'm like, is this what we did 10 years ago? Like, how can we define this in a way that helps people understand their symptoms, right? How can we help women feel their best and know what those symptoms look like? And, that is all part of what I'm always trying to do. But I do think asymptomatic has been loaded. Like, we don't know necessarily all the symptoms that correspond to fibroids. Like, in general, in the general population, people are not aware. So,
well, because we're also, I mean, they call the period the curse, right? We are also trained to believe, educated to believe that menstruation comes with cramps, back pain, fatigue, all of these things, myriad symptoms. So when we're doubled over with a heating pad and a bottle of Advil, why would we necessarily think fibroid?
right. We wouldn't. I mean, exactly. We are normalized. We normalize these symptoms as a society, right? We tell women, well, your periods are meant to be bad and heavy and debilitating. And, each woman thinks to herself, well, oh, maybe it's just me. Because I've heard these stories again and again. And it's like, oh, well, I just thought it was normal because I asked my friend, and she also said, "All my periods are bad." Or I asked my mom, and she says, "Oh, my periods have always been like that." So I just thought it was normal.
Well, even Venus Williams in the piece that I read that she did with your your facility was talking about how she had pain and fatigue and heavy bleeding, and she's like on literally on the floor, and everybody's like, oh, like,
Right.
yeah.
Everyone is sort of like, "Oh, that's your period. Take two Advil. You can get through it." And so I do think that as a society, we're conditioned to feel that, if we have pain or even if we complain too much, right, about our symptoms, that somehow we're not strong and it's our issue. It's not anything else.
Is there an age range in which they develop? I mean, are they just as common in young girls shortly after puberty as it is in maybe women who are hitting the menopause transition, or do they develop over time? If you develop one, are you more likely to develop more? How does that
Yeah.
work?
So, from the onset of your periods, you can start growing these fibroids. Typically, they do take time to grow. So, usually, I don't see women earlier than their 20s with fibroids. So, it's rare to have adolescents come in with large fibroids because they do take some time to grow. But women in their 30s, there's a range of severity. They could have one fibroid, they could have 50 fibroids. I mean, so that is something that we still need more research around. Like, why are fibroids more aggressive in some people than in others. And so that's one of the things we're actually studying at the Center for Fibroid Care. But, there are lots of layers to it. So I could see a woman in her 20s and she could have one or she could have 20. And those fibroids will keep growing until menopause. So I see women from between 20 to 51 regularly. And the thing that I want women to understand is even at 51, the fibroids will stop growing, but they won't shrink immediately. So just as they grew
Post-menopause, you're
slowly,
alluding to. Yeah.
post-menopause, yeah,
Mhm.
post-menopause, they will slowly shrink. So if you have like a lot of fibroids, what we call a high burden of disease at the age of 49, they won't magically disappear at 54. They are
Right.
still going to be there. There
Are
might be
they
a slight bit.
hormonally fueled? Are they
They're fed by
okay.
estrogen. That's why.
Okay.
So estrogen is the major driver.
Does
And
progesterone counter that as it might with other things, or we don't know?
not really. No.
Okay.
Estrogen drives their growth and stimulates more sort of cell activity. So it's really estrogen is the major driver. Um, and that's why actually, if you have more weight can also be a driver of fibroid growth because in fat, estrogen is converted.
Right.
And so that weight can then stimulate the growth of fibroids. So it is one of those risk factors.
Where does contraceptives then come in? And then, of course, hormone therapy.
I know. So this is what's been so interesting. So we'll get to hormone in a minute, hormone replacement. But birth control really doesn't have an impact on fibroids. I think people worry about it both ways. Like, is it driving the growth, or it's preventing the growth? It's not doing either.
Okay.
It is minimizing the lining of your uterus. So it could help you bleed less, which is helpful, but it's not actually changing the growth potential of fibroids. And so that is a big, I think, distinguishing, piece because a lot of people take hormones thinking one way or the other. Either they don't want to use it because it'll fuel their fibroids, or they're using it to minimize growth. So it really doesn't do either. Um, Progesterone alone also probably does not shrink fibroids, but it will again limit the bleeding, and it could overall make you feel less estrogen sort of dominant. So it kind of can pull down the levels slightly, we think, but it is not going to change the growth potential substantially. And then
And it's
hormone replacement. So that actually has been something new because, and this is we were talking offline about this,
yeah.
which I find so interesting right now, because never before have we had so many women coming in for hormone replacement in perimenopause,
In
right?
perimenopause, especially. That's a very new phenomenon.
Very new. So, and all the time I've been practicing, which is probably about 20 years now, we never had droves of women on hormone replacement in perimenopause. And so we are seeing, I think, especially in perimenopause, we are seeing some extra symptomatic fibroid patients, probably because of the hormone replacement. Because those excess hormones that are above and beyond what they're naturally making, could be fueling slightly the growth.
So what do we do about that? I mean, I have a couple of different questions just before we get to that point. When should a woman suspect fibroids, and who should she see to talk to if she suspects fibroids? And then let's really dive in a bit about the hormone therapy piece.
Yeah. I think that if women are experiencing symptoms of heavy bleeding to the point, and this is how I'll define it just to be, because people never know, well, what's heavy, what's not heavy. If you are missing days of work because of your period, if you are in so much pain or you're bleeding so much that you're not leaving the house, if you're constantly carrying around pads and tampons because you don't know when you're going to leak all over the place, um, if you're using more than one product at a time and you're using tampon plus pad for overflow, if you're using diapers, if you are using anything that is above and beyond, you know, kind of simply changing a product every 4 hours, that is probably too much bleeding.
Some women might conflate that with perimenopause in general, because you do hear women talk about quote unquote crime scene bleeding when they hit perimenopause. I
But
guess
I'm
it's possible
saying
that they can have that without a fibroid, but you might want to check for fibroids.
you might want to check for fibroids. I think that group should
Either
still
way,
check for
take care of it.
fibroids.
Either way, see a doctor, right?
I mean,
Either
if
way.
you're passing clots, if the clot, people tell me about golf-sized clots. Yes, that is not normal. That needs to be evaluated. And if it's not fibroids, it could be adenomyosis is another category, which I don't know how much we're going to talk about today, but there are other underlying reasons for you to bleed, but that bleeding is too heavy. Now, that is its own category, something I think people can relate to in their everyday lives. But if you're dizzy, lightheaded, if you need blood, if you need iron infusions, if you are getting an iron infusion, you need to be evaluated for fibroids. That's another category where I cannot believe that people have been evaluated and are getting regular iron infusions. Why? Like what is the underlying etiology of needing that much iron? So that should be a
Boy,
red
oh
flag.
boy. Yeah,
Yeah.
literally. I have a friend who has she was having terrible bleed, a lot like you're describing. Like the bed is destroyed. I don't want to leave the house. Like all kinds of things. And she does have a fibroid, and it's very small. And it almost sounded to me like her doctor was indicating that, oh, it's so small. It's probably not. But it doesn't matter what size, right? Yeah.
No. If you think your bleeding is excessive and you're changing your life around your periods, you should be evaluated. And when you're evaluated, you should get an ultrasound or ask for an ultrasound if it's not offered. Because fibroids are structural masses of the uterus that can be seen on ultrasound.
How would
So
they otherwise check for them?
I
Just
mean, you can see
just
them on
clinical diagnosis?
exam. Yeah, you can feel them on exam, but the problem is that there's a range of people doing exams, and you can't necessarily count on that as an objective piece of evidence. If you have a doctor who sees a lot of patients with fibroids or their specialty is that, then yes, they can do a pelvic exam and diagnose.
Right.
Um,
Right.
but I think because we want every woman to be able to know if she has it, an ultrasound is kind of a very easy objective test.
Excellent. And then what do we do with women who are wanting, needing hormone therapy for menopause, also who are having fibroids?
Yeah, I actually find this clinically kind of a complicated question right now.
Yeah.
Just yesterday, I had a patient who had really big fibroids, very, very large. And I wanted, typically, when you have really big fibroids and you're close to menopause, we try and use a medication to kind of reduce the volume and reduce the bleeding before we do like a procedure or surgery, just to get your blood counts up, just to, be able to give you a more minimal procedure or surgery. That's sort of how I use a lot of meds as sort of a bridge. But these medications, the ones I like that work well, drop your estrogen level
Oh,
slightly. And she was on hormone replacement and she was like, but I can't sleep and I have brain fog and I can't come off my hormone replacement for 3 months for this medication in order to get to surgery. So, I mean, we just kept the hormone replacement and, we'll do surgery without it, but it would be better if we could drop the estrogen, you know, just less bleeding. It can be a smaller volume that we have to remove. So those are sort of just techniques preoperatively. But yeah, a lot of women don't want to give, and I don't blame them. I understand, but yeah, that's sort of what we're trying to weigh the pros and cons right now. What is needed in each case?
where do IUDs fit into this picture?
IUDs are great. I really, really like IUDs. They support the endometrium, so they're progesterone secreting, the ones that are hormonal, I should say.
Hmm.
And they will thin the lining of the uterus, minimize the periods, and they are a great technique for minimizing bleeding, especially as women are transitioning through to menopause, because then at some point you can just add that estrogen patch. So I love IUDs. I think they're great.
Why do the fibroids cause so much bleeding?
It's where they're located, and the size. So the fibers that cause the most bleeding are actually in the lining of the uterus, where pregnancy would sit, in the
Hmm.
endometrium. And they bleed because the endometrium bleeds as the cells
Right.
build and cycle, and then the fibroid itself has borrowed blood supply from the rest of the
Oh,
uterus. So
okay.
it's very, these are vascular
Okay.
tumors. We didn't really
Okay.
talk about that too much,
Okay.
but
That makes, I
they're
couldn't make sense
vascular.
of it. Okay.
Yeah. So they create their own blood supply. So they just bleed on their own accord too. So you have like double bleeding. It's really, they're bleeding all the time.
Yeah. Okay. That makes more sense to me. I'm glad I asked the question. Um, I imagine there are some doctors who would maybe not immediately, but maybe quickly suggest hysterectomy.
Yeah. So I think that's been a really big awareness generating topic, right? And Venus talked about that actually in her articles too. Like doctors are quick to offer hysterectomy. And the problem with offering hysterectomy is, yes, it's definitive, like it's going to take care of all bleeding, all fibroids, everything.
Clearly.
But clearly, but for many women, it's dramatic, right? Or it's aggressive because maybe they want to maintain pregnancy possibility, or maybe they just want to maintain their uterus. And I think we see both groups. So yes, hysterectomy is definitive, but it may not be the best choice for every woman. And when I say that, at the same time that I say that, I will also say for some women, though, it might be the best choice. So not all things are always the same. So hysterectomy also does not equal bad, but I think you need to be offered an array of options and be able to pick the option that works best for you and that helps you achieve what you want in a very sort of personalized and individual way.
What else might be considered in that array of options? You mentioned the medication and also the issue with the medication for suppressing estrogen and maybe more minimally invasive procedures. Am I understanding
Yeah.
correctly that just removing them isn't necessarily the solution because they come back?
Well, removing them is probably the number one thing that we see as the
Okay.
the optimal choice for a lot of women because they want to become pregnant. So
Okay.
removing them in order to become pregnant, let's say, as one avenue, is a sought after type of surgery. We also have more minimal technology approaches now, such as radio frequency ablation, which can
Okay.
shrink the fibroids, and we have uterine artery embolization that can shrink the fibroids plus uterus. And both of those options are covered under most medical insurances across the country. So that's why they're the two that I'm mentioning. There's one other called MRI guided um, ultrasound ablation, but it's not hasn't really caught on as much. So I mentioned the two that are covered by most insurances. And then there's the surgeries to remove the fibroids, and then obviously the surgery to remove the uterus. And those are sort of the broad categories of options.
And is there anything specific that my audience, not professional tennis players like Venus, but they're very, very active women. We have women doing Ironman level triathlons and CrossFit games and all sorts of physical pursuits. Is there anything specific that they should know about this topic?
Well, I think that they should know that their fibroids could really be affecting their health. I think that's sort of the underlying message here.
Mhm.
So, if you are bleeding very heavily, if you have pain or pressure, fibroids are inflammatory masses of the uterus and they can affect your health.
Okay.
And then that affects your physical quality of life, right? So, like, if you are an elite athlete and you are competing at these higher echelons of athleticism, I mean, you need to feel as good as you can possibly feel. Like, you should not be iron deficient. That is definitely not helping you, right? Just as a minimum. Um, so I think that they just need to be aware of their symptoms, make sure that there's nothing out of the ordinary in terms of their iron levels or pain or pressure or periods, those sorts of things. As much as possible, I would think an elite athlete would want to suppress their periods altogether, to tell you the truth.
That's
Because
a whole other
that's
conversation for a whole.
that's maybe that's maybe another conversation, but like that, it only optimizes sort of, I think, their physical strength potentially, um, not to have
Yeah.
bleeding.
That is a whole other. I'll tell. We could. Boy, I don't want to go down this rabbit hole. The only reason that we are in an interesting place, let me put it this way, because as a former semi-professional athlete myself, I can
Yeah.
speak to this. There was a time when it was looked at as normal and probably good that women got to the point in their training that they didn't have their periods, and now we know that that is really a
Mm,
terrible thing and
right.
that is
That
not
is
good.
terrible. Yeah.
And we are now celebrating the period as a sign of
Yeah.
health
Okay.
and wellness.
Yes.
So it's to
It's
say that I immediately, you saw, I probably had a visceral reaction. I'm like, oh no, we're just
yes,
back to the point where we're like, no, it's okay.
but no, but those are two different
I
things.
understand.
Okay.
Go ahead.
Those are two very different things, because if you're not getting your period on your own, right,
Yeah,
it's because your body, your brain access is sort of shutting down your period because
totally. Low
you're under
energy
too much
availability, all
stress,
this stuff. Yeah,
under too, it's the fight or flight reaction, right? It's like, literally, I tell women it's like the wartime response where you don't want to be pregnant because you're under stress, you're under siege, your biological mechanisms are protecting you,
yeah.
basically. And that is dangerous. You don't want to have that if you're not in that situation, right? So not eating, being very low body weight, exercising too much stress can induce that. But that is very different than being healthy and using progesterone, let's say,
Right,
to
I
minimize
understand.
your period. You know what I mean? Like, those are,
Yes,
so that's sort of what I meant. I just
I I
didn't want
100%
your
knew that,
didn't
but I
want
was
your
just like,
people to think I was
yeah,
suggesting 100% no. You should be
yeah,
always as healthy as possible, but
yeah. No, I
progesterone
get
can
that.
suppress period.
We're all good. I just wanted to
Yeah.
go down that avenue a little bit because I'm like, we need to be very, very clear
Yeah.
because we're finally at the
Perfect.
place where athletes are like, oh yeah,
Yes.
that is a
They
bad
should be
thing.
100%. They
Yeah.
should be celebrated. And we want women having their periods. Absolutely.
So, are there other aspects of, while I have you here, uterine health that we would be worth talking about in this conversation?
Um, let's see. Related to fibroids.
Is
Well,
endometriosis, what is that?
yes, endometriosis and adenomyosis. Actually, we could spend a few minutes on that.
Okay,
So,
let's do that.
pelvic pain. So sometimes women who have fibroids come in because of pelvic pain, right? Pelvic pain, pressure, bloating. But other things that can give you those same symptoms, other gynecologic conditions, are endometriosis and adenomyosis, which basically means that cells that normally line the uterus leave the uterus and implant in other places in the abdomen. And that implantation of those glands that don't belong outside the uterus can create pain and bleeding, infertility, sometimes bloating, GI issues, a whole host of symptoms that mimic other things. And so for years, about 18% of the population has endometriosis. Again, I'll say that with the caveat that it's probably also underdiagnosed. So
Yeah.
maybe it's more, because again, women's health research could be better. Um, and
What's the difference
so,
between the two? I'm sorry, I didn't mean to step on your foot.
yeah, the two fibroids are these masses. They're like growths
But
that
I meant
become really big. Oh,
you said
oh,
endometriosis and then the other one. Okay, go ahead.
adeno means the endometriosis collects in the muscle of the uterus.
Oh, okay. Okay. Gotcha.
So, and when it collects there, it can sometimes even look like a tumor.
Gotcha.
But because it's sort of glandular activity, it can't be separated from the uterus like a fibroid can be separated.
Yep.
So it's very confusing, I know.
No, I had
But
never heard of the adenomyosis. Like endometriosis I've heard about forever, but the other one I had
yeah,
not heard about.
well, I just tell women it's endometriosis of the uterus itself. So like the
Okay.
endoglands are in your uterine muscle. So it's they're connected. Usually endo and adeno go together. And actually, often I see fibroids, endo, and adeno all together, or fibroids and endo all together. So it's very common to have multiple diagnoses. So that's the thing that can also make women's gynecologic health more complicated.
And the same question then applies now talking about perimenopausal women, menopausal women in the audience taking hormone therapy. What effect does that have on these conditions, like an endometriosis?
Sort of same thing. They're estrogen driven diseases. So endometriosis also estrogen driven. So you have more pain in your reproductive years post menopause, all of that improves.
Mm-hmm.
So again, the addition of hormones for longer could maintain those symptoms longer. We don't have a lot of research on this group. So, you calling me and asking me about it actually just sort of reinvigorated me to really be like, we need to study this particular group, because now that everyone's using hormone replacement, um, it really could be a driver of more symptomatic women for longer. It's hard to know. We've never had it before. But the winding down of estrogen definitely improves the symptoms related to endo, adeno, and fibroids. We do know that. So potentially for symptomatic patients, those symptoms could continue on hormone replacement.
Generally speaking, although this is a topic of controversial conversation as well, the levels of, and it's typically just estradiol, are not premenopausal when you're talking about giving a woman
Right,
menopause hormone therapy, right? Although
right.
there is a branch of people who are saying we should have premenopausal levels, and uh, it's going to be interesting to see how this all plays out in the next 5 to 10 years. But one would think with the lower levels, it would be not quite as problematic
I think you're
post-menopause.
right. I think that's what we don't know, right? Because so typically I would say, yeah, maybe it won't make too much of a difference. But when you think about menopause, it really drops those levels a lot. So we
Yeah,
still are maintaining levels that are higher than they
yeah.
would naturally have been. And we're doing that for all of the other great benefits, which I would never argue. There are wonderful benefits to replacing, a low level of estrogen moving forward, right? But I don't know, who knows? Because the relief that women feel at menopause is related to a sharp decline in their
Right,
estrogen.
right. Yeah, that's interesting. I mean, we see that with a few things. I've written about headaches and migraines and different kinds of migraines and just so many of these hormonally driven things. It's very much an art when we're
It's
talking
very
about
much an art.
supporting women through perimenopause, especially now that perimenopause is such a huge part of this conversation because it's such a moving target as opposed to a more postmenopausal state
I'm
where,
so honestly, I'm so happy you said that, because it really is a complex art. It really, that's the best way to think about it, because every woman is a little different, needs something slightly different, and how these factors play into, her life goals, what she needs, what she feels comfortable with, and any other disease processes going on is going to be more and more of an art moving forward. So we need physicians who are willing to kind of really take, be flexible, be kind of creative sometimes in how to use medications, procedures, holistic management, supplement management, right? All the sort of various avenues of care that we have to help women feel their best.
100%. And I'm again, I'm very grateful you've come on. I I'm kicking myself a little less for missing this because menopause itself is now, there was so much about perimenopause I did not know, which is why I started this podcast to begin with in 2020. And I feel like the whole fibroid conversation is just wrapped up in all of that, in that we weren't largely in the public sphere talking about any of this.
True. Exactly. That's why we need you. we need we need people out there talking about these issues and helping women make sense of them, because I also don't think it's a one-time discussion, right? Like, we
Oh,
have
yeah.
this discussion, but it's so complicated. I hope people get some, some kernels of truth out of it that apply to them. But I think hearing it again and again, understanding how they feel related to the symptoms. I think the conversation needs to be just regular dialogue about it to really help women be their best.
And we also had 20 years when nobody was talking about hormone therapy, or at least not too out loud.
No, they weren't talking about it. I mean, that's a whole other huge myth, I think. So I really, when I think back on it, I just think the medical establishment was actually very much not in favor. I mean, you were, as I was saying offline, you were very much going against the grain in prescribing hormone replacement. That is what those days were like. It was, I was prescribing it, but women were being told by every other doctor, you can't have it.
What
It's
gave you the fortitude to prescribe it anyway?
Oh, I think, honestly, it's women themselves. Like, I have always listened to what women are telling me, and I
Imagine.
really imagine, right? And I can't understand how, like, if the 20th person comes into your office and tells you the same thing, at what point do you say, "Wait a minute, maybe there's something here that we're missing, that really needs to happen." And that's kind of what happened with me and fibroids, honestly. It was, years and years of women coming into my office saying, I went to 5 other doctors. Everyone told me I could only have a hysterectomy, or people said it doesn't matter that I have fibroids, they're small and I should do nothing. Or they said, oh, you should just wait till menopause.
Oh my
Meanwhile, the
God.
patient's 34. That was another big
Oh
thing
my
I would hear
God.
all the time, story after story, like, and they were the same stories. And finally I got sort of further along in my career, and I'm like, you know what? Maybe there's a better way that we could change how this care is being provided. And I kind of lobbied for the center of care that we have now. But
Oh, that's awesome.
yeah, that's sort of how that all came to be. And that's how, I guess, Venus found out about us and others have. And it's meant to be a place where we use all of our tools to reach the best outcomes for patient. But I love that you talked about the art, because I really think it is an art.
100% is smart. Well, thank you for your service. Thank you for pushing through and listening to women, and more importantly, acting on that. I see that a lot with the women that I have on this show, and I know it takes a lot to do that. I know what that looks like. I know how traditional, I know how it's hard to push against the powers that be inside institutions, medical institutions, academic institutions, all of these things. I see it all the time. And I always stand up and applaud the women who are brave enough to follow that instinct and do something, because we need that.
Thank you. I appreciate that. I think we all need to be part of the solution, honestly. So if this is this is our lives, we're one community. So if nothing else, we need to be partnering, we need to be supporting one another. That's probably a whole other podcast, but I truly, truly believe that women need to be standing up for their rights and banding together and becoming even a stronger community than they are in every way, you
100%.
know.
Excellent. Well, thank you so
Excellent.
much again. I appreciate the work you do, and I will drop all of your resources into our show links so people can find you.
Thank you so much.
Well, that's our show. Come on back next week when I sit down with Kim Beckinsale and Elena McMaster from the Mountain Designs Wild Women Adventure Racing Team. Last year, that team became the first all-female team to win the 450-kilometer Legend Expedition race on Australia's Great Ocean Road, and they did so in 73 hours, 9 minutes, and 27 seconds, while navigating only by map and compass with only about 5 hours sleep along the way. They are currently at Expedition Canada, where they are covering 600 kilometers of trekking, trail running, mountain biking, rafting, canoeing, you name it. And it is just a real treat to hear how they have navigated menopause with all of these adventure racing challenges. So come on back for that one. And until then, as always, stay feisty. You've been listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I'm your host, Celine Yeager. The show is edited and produced by the strong, talented, and amazing women at Live Feisty Media. Follow us on social media at Feisty Menopause, and please help us spread the word. Screenshot and share this episode on your social media channels with the tag @FeistyMenopause. Share the show with your friends, and please subscribe, like, review, and rate this show wherever you get your podcasts. Word of mouth and good reviews make it easier for other listeners to find. Thanks for listening, and as always, stay feisty.